The Human Performance System is a powerful management tool. The premise of the Human Performance System is that we look at the entire process, beginning with the performer, including the performer's capacity, knowledge, and skill. Then we consider the inputs or resources provided by management, outputs, feedback by management, and consequences. Most important to remember, when there is a system failure, the performer should be the last factor considered. One of the worst work circumstances to be in is when a manager blames the employee for continual failure, but fails to address the real issue, that there may be system inadequacy. And going a step further, if there is inadequacy discovered, taking the time to work it out. At work, we've recently taken over 2 small physical therapy clinics that employ 1 therapist and 1 front office employee. The 2 travel together between offices on alternate days. For this presentation, we will concentrate on the front office portion of the clinics. The front offices were running at low-level capacity, with the performer engaging in basic office tasks such as answering the phone, scheduling patients, verifying insurance, and performing some case management. My directive was to increase processes and performer tasks to mirror that of existing Edwin Shaw outpatient therapy clinic front offices. Looking at the Human Performance System, we begin with the performer. In this case, we'll call him Bob. When Bob began working in the therapy office a year ago, he was given 2 hours of training. Because Bob is the lone office worker, he was often frustrated due to lack of knowledge and support. But Bob reported that he would call his supervisor, but his calls would go unanswered, or the clinic needs would be put on the back burner. Bob was frustrated. Bob had the capacity, physical, mental, and emotional. He has skills. What he was lacking was knowledge of how to do his job. Also lacking were inputs, such as work instructions, tools, and other resources like access to necessary computer applications. Between Bob and the therapist, they limped along doing the best they could with the available resources. Their outputs were satisfactory, but morale was low. And there was little to no feedback. Consequences were typically negative due to frustration. After an assessment was done, we were able to identify the knowledge that was lacking to efficiently perform tasks using the existing resources and identify inputs lacking to perform day-to-day tasks. We created an action plan and timeline based on the assessment and went to work training and introducing new processes. We are coming to the end of the project and are happy to report that outputs, tangible and behavioral, are on the upswing in the way of increased revenue and employee satisfaction, which spills over into patient satisfaction. Additionally, I am able to give Bob immediate, accurate, and specific feedback. Bob's consequences have been mostly positive. The negative consequences come from the anxiety Bob has as he navigates his new responsibilities. I have communicated to Bob that we will hold our timeline loosely and will continue to provide training and support on a regular basis. Bob considers
created using Powtoon.